Hi everyone, my name is Grace Kim, and today I'll be presenting on the topic of period poverty amidst the global pandemic. So before I start my presentation, to introduce a little bit about myself, I'm from Seoul, the Republic of Korea, and I'm currently a rising senior at Seoul Foreign School. Some of the extracurricular activities that I'm involved in school is girls basketball. I was the captain for the 2019 to 2020 season. I'm also part of the school's National Honor Society, Mu Alpha Theta, and the Chime Music Honor Society chapter. And I'm also the founder of the Mini Moon Project, and I'm interested in fields of healthcare and women's rights. 2,535 days. This is how many days an average person spends her life menstruating. Considering that one pad costs $0.24, the menstruator uses $1.2 a day just for pads. This totals up to $3,042 just to purchase pads. On top of that, women have to buy new underwear, painkillers, and heating pads during their menstrual cycle, adding on to this price. Globally, a minimum of 500 million women are unable to afford these products every month. Period poverty refers to the prevalent phenomena of being unable to afford products such as pads, tampons, or liners to manage menstrual bleeding. Women are forced to use items like rags, paper towels, toilet paper, or use them for extended amounts of time. However, period poverty not only limits itself to being unable to afford these products, but also extends further into inadequate access to toilets, hand washing, and hygienic waste management as well. There are many challenges that arise from inadequate menstrual hygiene management. Countless women face the dilemma between purchasing food and menstrual products. Needing to purchase food for their family or for themselves, the lack of menstrual products ultimately leads these girls to miss school frequently when they're on their periods, or even use some unhygienic insole of their shoes to substitute for menstrual products. Period poverty is an important global health issue that we must focus on today because access to menstrual products is a fundamental right, and feeling clean, confident, and capable during one's period is a necessity. So why is period poverty a global health issue? The rags, paper towels, and reused pads put menstruators at heightened risk for urogenital infections such as urinary tract infections and bacterial vaginosis. Statistics show that women who had unhygienic menstrual practices were 95% more likely to have symptoms of urogenital infection than women with hygienic menstrual practices. According to data from the National Health Insurance Service in Korea, for the past 11 years, teenager urinary tract infection patients were 1.6 times greater from the bottom 10% income bracket than the top 10%. Urinary tract infections can happen anywhere in the urinary tract and can even damage the kidneys if left untreated. Furthermore, susceptibility to cervical cancer is increased due to reproductive tract infections and urinary tract infections. Women even resort to free contraceptive injections when they cannot afford menstrual products. Having these complications and receiving treatment add on to the economic burdens that they already have due to period poverty. The lack of menstrual products not only impacts the woman's physical health, but also mental health as well. Out of 1,000 women, 40% of women who do not have proper access to sanitary products suffer from anxiety and depression. These women face hindrance in daily activities due to the lack of menstrual products, which causes social isolation as well. The issue of period poverty extends further into other global health issues as well. 1 in 5 girls around the world miss school due to period poverty because they're conscious about their body odor or period lacking from the lack of menstrual supplies. Women in Guinea explain that many girls fall behind school after missing multiple classes during the menstrual cycles, having limited job opportunities. They're taken out of school by their parents with their intention of getting married, and this leads to further issues such as forced marriages, domestic violence, child pregnancy, and rape as well. So how did COVID-19 impact period poverty? The increase in menstrual product demands increased nearly 6 times their usual amount during the pandemic. The struggles of period poverty had exacerbated during the pandemic, with families experiencing a decline in their income and increased economic challenges. Since the pandemic began, 1 in 3 menstruators are worried about their ongoing ability to afford menstrual products. Stockpiling and hoarding behaviors have limited the accessibility of products for those who may need them. And due to social distancing and lockdowns, even basic shelters and organizations face challenges in volunteer runs and donations. In addition, burdens are further imposed on families as menstrual products are taxed. While food and medications are considered as an essential product, menstrual products are still classified as a luxury item. Programs that low-income families may need to get medical and food assistance don't cover period products, which further exacerbates the problem. So what can we do to tackle period poverty? Obviously, the most direct way to tackle period poverty is through menstrual kit support. What the organization that I have found, the Minimum Project, aims to do is to support sustainable menstrual kits to teenage girls in need. We specifically focus on giving long-lasting help. Therefore, we donate and educate the girls about the menstrual cup, which is an alternative menstrual product that is able to be used for 12 hours for over 10 years. When you're looking for organizations to help, it is important to avoid organizations that give one-time donations, because essentially it only helps the girls once, not doing anything to uplift them from period poverty. A more feasible method that we can approach to eradicate period poverty is to eradicate menstrual taboo. One of the girls who received support from the Minimum Project has said to me that taboo culture makes it seem like menstrual blood is not a natural thing, but a curse. There is very limited awareness and education about menstruation, which allows this belief to persist and dictate social norms. Therefore, as educated youth, it is important to normalize the process of menstruation so that these girls have a proper supporting platform. To do so, having to advocate and educate yourself on this issue is very important. Start from small actions like reposting an educational post on Instagram or talking about other friends and family members about period poverty and the cycle of menstruation. Lastly, here are the sources that I've used, and I would like to thank the Johns Hopkins Global Health Conference for giving me the wonderful opportunity to present, and I hope you guys have a great day. If you guys have any further questions about the issue or learn about the Minimum Project, you can contact me via Instagram or visit our website. Thank you.